Hi, my name is Kate Edelstein. I am the Clinical Director here at California Prime Recovery, as well as a licensed marriage and family therapist. Today, I'm going to talk to you a little bit more about our teen program. I want to talk about a couple reasons why a virtual program is a really great choice for working with teens. First reason why is a lack of disruptions. For a lot of folks, when they're deciding to send their teen to a program, one of the things that you have to keep in mind is that there's going to be a disruption to family life. Sending your teen away, potentially to a different city, to a different location, that is a huge decision to have to make both for you and for your child. What is really nice about the virtual format is it allows your teen to learn all of these skills while still staying at home, while still having that connection to family that they might rely upon to help them get through. Second reason, convenience. This can happen anywhere. For a lot of teenagers, they have to rely on their parents for everything. If they want to go spend time with friends, if they want to go to the store, they have to wait for mom and dad to drive them. Being able to do a virtual program means that you can do it literally anywhere. You can do it from home, you can do it from grandma's house, you can do it wherever you need to, which allows that convenience and accessibility that might not be available for a parent who's having to work super late, or for a kid who really wants to be engaged but just doesn't have the option to get themselves there. Another reason, comfortability. For a lot of treatment centers, and I say this even at working at one, we do our best to make it as comfortable as possible, but there's still that element that it's not home. It doesn't always feel comfortable to go to a treatment center. It doesn't always feel quite the same way as it does when you're in your own bedroom, when you're with your own things, the things that you maybe rely on to make you feel safe enough to open up and share some of those vulnerable things that we ask you to do in our groups and our therapy sessions. Going to a sterile environment can sometimes take away some of that relaxation and comfortability that might allow a teen to open up for the first time. So we allow people to have that comfort of home while still engaging in a program. Also, accessibility, and that's a huge one. I know a little bit about accessibility when it comes to physically bringing yourself into a location, but when we're talking about working with mental health, we have to talk about mental health accessibility. There are people who we work with every day who maybe are struggling with anxiety, who maybe have a disorder on the autism spectrum, who maybe are facing elements from post-traumatic stress disorder that makes going in person to a location almost impossible. We talk constantly about meeting people where they're at. That's a huge part of therapy. It's a huge part of treatment. But if we actually want to do that, we have to bridge the gap. And for some teens, and really anybody going into treatment, going into therapy, having to bring themselves to a location that is too difficult for XYZ reason stops them from being able to start the work. They're not even able to start the conversation. So being allowed to do this from home means that teens and everyone else who engages in our virtual programs have the opportunity to actually get the support that they're looking for in the way that works for them.